inferior aperture or outlet of the thorax is formed by diaphragm. In other words, inferior aperture or outlet of thorax is closed by a large musculo-tendinous partition called the diaphragm, the thoracoabdominal diaphragm, which separate the thorax from the abdomen. The boundaries of the diaphragm is anterior, posterior, and lateral, or on each side. Its anterior diaphragm is attached to the infrasternal angle. In the posterior, diaphragm is attached to the inferior surface of the body of the 12th thoracic vertebrae, and on each side the diaphragm attached to the costal margin, like this. Here is from anterior and here is from the posterior. As you can see here, in the posterior, the diaphragm is attached to the inferior surface of the body of the 12 vertebrae. Here we have a true cross, right cross, and left cross attached to the 12 body of the thoracic vertebrae. The diaphragm of the outlet of the thorax, or called musculo-tendinous or diaphragm or thoracoabdominal diaphragm. As you can see here, and look at from the inferior surface of the diaphragm, we have a muscular part in the periphery and the tendinous part in the central. And we have one, two, and three big foramen that are passing through the diaphragm or outlet of the thorax. So, the structures passing through the diaphragm in the next subject I'm going to talk about it. The structure passing through the diaphragm, there are three large and several small openings in the diaphragm which allow a passage to structures from thorax to abdomen or vice versa. You can see here in the schematic pictures 1, 2, and 3 large openings and several small openings in the diaphragm in a different part of the diaphragm. So I'm going to talk about this structure that are passing through the diaphragm. Large openings are the first structures. These are vena cava opening in the central tendon, esophageal openings in the right cross of the diaphragm, and the aortic opening behind the median arcuate ligament. Median arcuate ligament, that is in a green called medial arcuate ligaments and lateral arcuate ligaments. So we have three arcuate ligaments attached to the diaphragm: median arcuate ligaments, medial arcuate ligaments, and lateral arcuate ligaments. So the median arcuate ligament is around the aortic openings. Small openings in the diaphragm are superior epigastric artery, here superior epigastric arteries, passes in space of Larry present between slip of xiphoid process and seventh costal cartilaginous slip of the diaphragm. When this foramen is enlarged, it is known as foramen of Morgani. Musculo-tendinous artery perforate diaphragm at the level of seventh costal cartilage. Lower 5 intercostal vessels and nerves pass between costal origins of diaphragm and transversus abdomen. Subcostal vessels, here, look at this here, subcostal vessels and nerves pass between costal margins of diaphragm and transversus abdominis. Um, Subcostal vessels and nerves pass behind lateral arcuate ligaments. As you can see here, we have a subcostal vessels and artery that are passing behind the lateral arcuate ligaments. Sympathetic trunk in a yellow color, sympathetic trunk passes behind medial arcuate ligaments. We have two small opening in a right and left cross of the diaphragm called greater and smaller opening. So greater and lesser splanchnic nerves pass each cross. Left phrenic nerves also pass left cross of the diaphragm. In this table, there is a very important things to learning about a large opening in the diaphragm called vena cava, esophageal and aortic. There are openings and situation of each openings, shape of each openings, and structure passing through the openings and effect on contraction. For example, vena cava inferior situated at 8th thoracic vertebrae, junction of right and medial leaflet of the central tendon, and its shape is quadrilateral, and the structure are passing through the vena cava opening are inferior vena cava veins, right phrenic nerve, and lymphatic of liver, and effect of contraction of the diaphragm on the vena cava opening is dilation. The second example of the large opening that are through the diaphragm is esophageal opening that is located at 10th thoracic vertebrae, splitting of the right crus, and its shape is elliptical, and a structure that are passing through the esophageal openings are esophagus, both vagal trunks, left and left gastric vessels that gets back from the abdomen to the esophagus. An effect of contraction of the diaphragm on the esophageal opening is constriction. And the last opening of the diaphragm, that's path through the diaphragm or outlet of the thorax, is aortic opening that is situated at 12th thoracic vertebrae behind the medial arcuate ligaments, as you saw in the last slide, and its shape is rounded, and structures that are passing through the aortic opening are aorta, thoracic duct, and azygous veins. An effect on contraction on the opening aorta is no change. This is very important things to learn, that the contraction of the diaphragm there has no changing on the aorta, because the aorta is most important artery in the body that carry the oxygenated blood from the heart to all of the body, and the contraction of the diaphragm and aortic may be interrupt the blood flow to the organs. In this slide, I'm going to talk about surface landmarks of thorax. In fact, thorax has a lot of landmarks, bony landmarks and or soft tissue landmarks that we can use to identify different organs and structure inside the thoracic cage. For example, landmarks of the thorax are bony landmarks and soft tissue landmarks. In the bony landmarks category, we have a suprasternal or jugular notch, sternal